At the lower end of your esophagus, there is a ring of muscle known as the lower esophageal sphincter. This remains closed except when eating. Content of your stomach coming back into the esophagus is known as reflux. A small amount of reflux is normal and occurs in healthy adults. When these episodes are frequent, long, causes symptoms or complications, this is known as Gastro Oesophageal Reflux Disease. The most common symptom of gastroesophageal reflux is heartburn. This is a burning type pain in the center of your chest. Some people also get an acid taste in their throat. Other symptoms of reflux include difficulty or pain during swallowing or pain in the upper abdomen. If the acid gets into your throat, you may get a sore throat, a change in your voice, or a long-standing cough. Some symptoms may indicate a more serious problem. These include difficulty or pain during swallowing, severe chest pain, unintentional weight loss, vomiting blood or passing dark-colored stool, or sudden worsening of your symptoms. If you notice any of these symptoms, you need to see a doctor soon. Most patients with gastroesophageal reflux disease do not develop complications. If the acid exposure is severe or goes on for a long time, you may develop complications. You can develop ulcers in your esophagus, and these ulcers can bleed. The damage can cause scarring of the esophagus, and this can lead to narrowing and blockage. This narrowing is known as a stricture. When acid comes into contact with your vocal cords, it may cause hoarseness. Ongoing damage due to acid exposure will cause the normal cells in your esophagus to be replaced by a different type. This is known as Barrett's esophagus. Acid reflux is a major risk factor for cancer in the esophagus. Gastroesophageal reflux disease is usually diagnosed based on symptoms. Occasionally, your doctor may request some investigations to confirm the diagnosis. An upper GI endoscopy allows the doctors to see inside your esophagus to identify any changes due to reflux. Doctors can also take biopsies to exclude cancer. Esophageal manometry measures the contractions of the esophagus. This can help determine if the lower esophageal sphincter is functioning properly. A 24-hour pH and impedance testing measures the frequency and amount of acid reflux. This involves inserting a special catheter with sensors into your esophagus to measure the acidity. If you would like to know more about these tests, you can watch my videos here. The treatment primarily depends on the severity of your symptoms, and the presence of complications. In any case, there are some lifestyle changes that will improve your symptoms. If you are overweight, losing weight will help reduce reflux episodes. You can raise the head end of the bed to reduce nighttime heartburn symptoms. If you notice food or drinks like chocolate, coffee, or alcohol worsens your symptoms, you need to avoid them, as these may be relaxing your lower esophageal sphincter. Quitting smoking will also improve your symptoms. If you have mild symptoms, you may be prescribed an antacid to neutralize the acid and a histamine antagonist to reduce the acid secretion. If you have severe symptoms, you will require a proton pump inhibitor. The commonly used ones include omeprazole and pantoprazole. These are more effective than histamine antagonists. If your symptoms are not controlled even with this, the doctor may change your medication or ask you to take it twice a day. If you remain symptomatic despite optimizing your medical management, or if you develop complications like Barrett's esophagus, you will require surgery. This involves strengthening the lower esophageal sphincter by wrapping the upper part of the stomach around the lower part of your esophagus. The commonly performed procedure is called Nissen fundoplication. If you would like to know more about this or have any questions, please leave a comment below. You can also comment on any topics you would like me to cover in the future. Thank you.